Cedars-Sinai Medical Center. I am going to present on how induced pluripotent stem cell-derived macrophages can be a preventative treatment for knee post-traumatic osteoarthritis. Unmet clinical needs of knee post-traumatic osteoarthritis include an ACL rupture that leads to PTOA in 25 to 50% of the patients in 20 to 20 years post-injury. Some treatments for severe PTOA include joint arthroplasty or fusion, which are not ideal for younger patients. There are also no known therapies that halt or reverse the progression of PTOA in patients. Therefore, our aim is to find cell therapy treatments that can hinder the progression of PTOA. Potential of cell therapies. We first aim to determine the immunogenicity of the iPSC derived cells when injected into nude and SC rats after an ACL tear rupture. Second, we aim to differentiate iPSCs into iMacrophages for a potential treatment of PTOA. And lastly, we aim to create an appropriate PTOA development model via non-invasive ACL tear in SD rats. Genicity of human stem cell therapies in rat models still pose a challenge due to Sprague-Dawley rats being immunocompetent and having the frequency to reject human cells. On the other hand, nude rats are immunocompromised and their suppressed immune system allows them to accept human cells. Due to the rat models having their pros and cons, we decided to inject iPSC-derived mesenchymal stem cells in the injured and uninjured knees, which are considered an immunoprivileged area in both rat models. Compared, we looked at adaptive immune antibody IgM levels, as well as CD8 positive cells, in which we found no significant difference. PTO patients having an imbalance in the immune microenvironment of the injured area, macrophages have been shown to be a critical breakthrough. iPSCs are a valuable cell source due to their unlimited self-renewal abilities as well as plasticity. Therefore, we have differentiated iPSCs into macrophages, in which we have demonstrated their CD14 surface markers and phagocytic activity. Arthritis in rats still remains unstudied, and from the studies that have been done, there have been different outcomes. Therefore, we aim to create a non-invasive tear to study the progression of PTOA. We created the non-invasive tear in Sprague-Dawley rats, in which we analyzed collagen fragments and IL-1 beta to determine the PTOA development. For this presentation, we have shown that nude and SD rats have similar xenoreactivity to iPSC-derived mesenchymal stem cells and successfully differentiated iPSCs into iMacrophages. We have also created a non-invasive ACL tear that leads to PTOA development. Therefore, our future study is to study the effect of iMacrophages in treating SD rats that have undergone ACL tear to hinder PTO progression. Thank you for your time. If you would like to learn more about my research, please stop by my poster, which will be located in 515 on Thursday, June 15 at 1:30 p.m. Thank you so much.